Welcome back to The Smile Effect. On today's episode, we are taking a deep dive into what TikTok gets wrong about cosmetic dentistry. There are some wild trends out there, and we are here with Dr. Michael, and we're going to break down some of these crazy trends. But first, what made you smile this week?
Well, this week, Mckenzie, we got a new telescope. Small little thing, but it's a really good one that we can take some photos of the galaxy and those sorts of things, and stars, all that sort of stuff. So the kids have been getting really involved in that.
Oh, great.
So it's been great quality time to spend with them. That's what's made me smile. Yeah.
Have they had fun trying to find different stars in the sky or things that they can see?
It does it for you. So you just pick where you want to go, and then then it takes itself there, which is nice.
That's so exciting.
Yeah, so it keeps it nice and simple for them, but very interactive, which is always good.
That's so exciting.
That science interest there.
Yeah, absolutely, especially whilst they're so young. Oh,
and
great.
What about you? What made you smile last week?
We have finally taught our border collie to return the ball after playing fetch.
Very big moment.
We were doing a lot of running, so we can keep the steps down, and little Stella can do all of that herself.
Fantastic.
Okay, great. Well, we'll go into the first one. This one is a little bit wild, but I'm excited to see your take on it, and that's DIY teeth filing. So we've seen some TikTok videos of people using nail files to file down some unevenness, some length in their teeth. I need to know your thoughts about this.
Are we talking like emery boards, or are we talking like those metal files with the little ridges on them?
We've seen everything under the sun.
God, I could just imagine the little ridges would just be the most uncomfortable jackhammer kind of sensation ever.
I'm just thinking nails on a chalkboard.
Yes.
Why do you think people are thinking that it's working?
I think there's a lot of emphasis behind having sort of ideal positions or edges to the teeth, those sorts of things as well, and shapes. And it becomes quite accessible in a way if you've got those sorts of things at home, or you pop down to pharmacy or supermarket and grab one of the emery boards, those kind of things, that you feel you can adjust the teeth to your liking around there. So it's something that people, I guess it's cheap, they've got control over as well, because they're the ones that are doing it, and they've got the image in their mind of where they want to go with everything else. So you put those two together and it becomes a very accessible thing to do. It may not be the best, but accessible.
I mean, definitely accessible, but what do you think are some risks of people doing that at home?
There's lots of risks, unfortunately, with something like that, because with enamel, it doesn't grow back.
Right.
With any tooth structure, it doesn't grow back.
Yep.
So when you take it away, it's a permanent change that you're making to that area. So as soon as we take away a little bit of the enamel, which is the protective coating over the top of the tooth, we're losing a lot of protection to the tooth underneath. So things like sensitivity becomes an issue. There's a risk of nerve damage if we go too far, and that can lead you down the pathway of like really bad sensitivity, or even things like needing root canal treatments or extractions if you went to the nth degree.
Oh, gosh.
So it's pretty scary sort of consequences if we're not paying attention to the changes that we're making, and it's not something that you can just wind back the clock and go, okay, I'll put it back because I've taken too much off.
Yeah, that's a permanent decision.
Yeah, if you're taking off, most of the time you're going to be adjusting one and then adjusting the other. So it's a little bit like if you were adjusting pants legs or something like that, and you're taking one up and then the other one up.
And next minute you know
it's a little bit off, so you take the other one up a bit more, and it just keeps going.
Yeah.
You chase your tail a fair bit, and you could end up taking a much more than you initially planned to remove.
Yeah. What do you think are some alternatives for people to really consider before they decide to go down to the shops or grab the nail file from in the drawer? What would you say rather than, don't do it?
Yeah. Look, there's lots of alternatives you can have a look at, but I guess the most important thing is to have a clear goal in mind, or even not necessarily a clear goal, but a goal in mind about what you want to do. If you're not happy with, say, chips or uneven edges of the teeth, or if you're not happy with the length of the teeth, things like that.
Yeah.
And then the best thing to do is to go see your dental professional. So go visit your dentist and talk to them about these kinds of things.
Yeah.
There's always going to be different ways to approach it. So some people might look at uneven edges and look at edge bonding, for example. Very low biological cost. You're not really taking away any tooth, and you're building that back up with tooth-coloured filling material around there. It's a very cost-effective procedure, really protects the edge of the tooth, and it gives you something else there as well. So that's a great way to approach, say, a chipped tooth around there. If we're talking about too long, or we need to reshape the tooth, then we've got to work out where we actually want to end up, and the dentist can do that in a very controlled manner around there as well. We've got good ideas of how thick the enamel is, what sort of changes need to be done, and also polishing it up. Because if you leave it really coarse, you're more likely to chip things off in the future and develop crack lines in the teeth. So it's one of those things, you go in there too hard and too fast, it can be a real issue for you as well. So definitely, dental professional, talk to them about it. It can be some really cost-effective solutions to be able to achieve it, but you take the risk out of doing it as well, and you're not having to take too much away and then go see the dentist anyway to get it built back up.
Definitely chatting to someone, talking about your options instead of making any rash decisions.
Yes.
I even clench at the nail salon sometimes, so I can't even imagine that happening to my teeth, which, crazy.
Yeah, very, very close vibrations. You'll be feeling everything.
Yeah, definitely. And I guess on that, feeling everything, another viral trend that's going around, at-home teeth whitening, but not with your standard at-home whitening kits or strips. It's leaning into lemon juice for whitening or charcoal scrubs. I really want to know your opinion on these because two different options that people think can get a really good result, but what's your take?
Looking at those two products, I mean, lemon juice, you've got very acidic compound around there. It does actually have quite a lot of sugar in it as well. Charcoal, like your activated carbon charcoals or those sorts of things, they tend to be quite abrasive. So they do actually have an effect on, say, whitening the tooth. So you can get rid of external stains on a tooth with something that's really abrasive, but it's a little bit like the emery board before. But if you're putting something really abrasive over the top and you're scrubbing away at it, you'll get rid of the external stains, but how much of the rest of the tooth are you taking away at the same time?
The good stuff.
Yeah, and so in the past there have been some toothpastes that have been created that had both an acid in it for whitening purposes, an acid as well as much more abrasive compounds like the activated charcoal, those kind of things. And they've been taken off the market because they were just too aggressive.
Yeah, those charcoal toothpastes.
That formulation's all changed. A lot of the big companies sort of dumped those sorts of things in favour of things like that had peroxides in them, so the more active ingredients to lighten teeth, things that we'd use in a professional dental setting, just at lower concentration. So you can't safely buy higher concentrations that we'd be able to use in a dental setting when we understand sort of gum issues, sensitivity, all those sorts of things that could come from it. And you really want to be looked after when you use those strong things. Yeah. But you can buy toned down versions of that which don't have the same sort of very abrasive, caustic kind of more acidic issues.
And do you think using those whitening strips at home is as evasive or as effective, say, as in coming to see your dentist and getting whitening done here or with their at-home kits?
They're not going to be quite as effective, but they're generally going to be better than, say, the really coarse or acidic toothpaste or using lemon juice or charcoal, for example. They're going to cause less damage to the teeth, and they'll generally have a really light version of the hydrogen peroxide in there as well. Because when you put those trays or the strips on, you can't really control where it goes. It'll go onto the gums, it'll go onto the teeth, it'll do its job. Yeah. But if you had something really concentrated like what dentists use, you'll find that will burn the gums. So when you come into the dentist, we're going to put a really protective barrier over the top of the gums, so it's just the teeth that get that exposure. So everything's nice and safe, everything's protected around there, and you know that that's going to be a pretty safe procedure to do. When we're talking about effects, you're going to find much more dramatic effects when you can use a higher concentration in a short space of time, because that change happens very rapidly around there too. So you can get more shades lighter as well as a concentrated time that you're doing it in. When you do at home with, say, instead of 30% or those sorts of things, you go down to 1, 2, 3% hydrogen peroxide or carbamide peroxide around there, then you're going to have a much slower change, which can be almost not noticeable, but you're going to have to do it for a number of months around there as well.
Just to see that change.
Yeah, so by the time you buy all those strips, you're probably going to be at the same cost anyway of coming in and doing those sorts of things. So if you're looking at whitening things, usually people are looking for that change. They want to see the effect. They want that pop around there as well. And the best way to do that is to just get someone to do it for you. That way you know it's safe, it's effective, and you're in good hands. Yeah.
And for those people that have dabbled in the lemon juice or the charcoal scrubs and they are experiencing that type of sensitivity, is there a way to come back from that, or is that something that they're going to have to navigate with long term?
It depends on how far it's gone.
Yeah.
So if it's sort of acute, so something that's just popped up around there, then it can be something that is reversible. We say sensitive toothpaste, those sorts of things.
Yeah.
If they have gone too far, then it can be something that is irreversible.
Yeah.
And cause sort of that real permanent damage to the teeth. And then we're talking about sort of, in both cases, it's best to see your dental professional, but we're talking about if lots of tooth structure has been lost, lots of sensitivities happening, and it's just a chronic pain that they're dealing with, dental intervention and actually doing something to rebuild the lost tooth structure around there as well. So whether it's things like veneers and restoring that that surface, or bonding to help restore it, I mean, they're great solutions for people, but you don't want to be forced into doing it by making some of those mistakes at home.
Yeah, 100%. It's a scary one to dive into because teeth sensitivity can be so painful for so many people.
Yeah, well, you can't avoid using them. You've got to.
Yeah, yeah, 100%. And I guess moving into the next one with teeth is, as someone who struggled with having gaps in their teeth prior to braces and crowding, people are now turning to trying to use floss and string around their teeth to close those gaps, which I can't wrap my head around how that's going to make that dramatic effect with your teeth. But what's your take on that versus going down the orthodontic or clear aligner route?
It's a creative solution.
That's for sure.
Certainly, it's tapping into one of the reasons why orthodontic treatment works.
Yeah.
So when you put pressure onto a tooth, it sort of stretches the ligaments that are holding the tooth in on one side, compresses them on the other, and that signals the body to start shifting the bone and sort of put down a little bit more bone on one side, take away a little bit of bone on the other side, and it helps move the tooth slowly. But the key thing is it moves it slowly around there. So it's got to be slow and controlled movement that you're doing. Putting too much pressure on, the body does something that's not, it thinks is a good idea, but it's not necessarily in your best interest. So you'll lose that bone as you shift the tooth, and it will start putting stuff down. But the tooth root is like an anchor. And the easiest way to move that tooth really fast is to reduce the size of that anchor around there. So you get root shortening as well.
Right.
And that's what's supporting the tooth. So if you move things too quickly, you risk shortening that root, and that's the stability of the tooth gone as well. So really important thing that, yes, you can move teeth with pressure. That's an established kind of fact. If you put too much pressure, they can come out. But from that side of things, if you're looking at moving it, it's got to be that controlled, steady pressure that you're placing in there to avoid pushing things too hard. With things like, say, elastic bands or even orthodontic modules around teeth, those sorts of things, there have been studies in the past where they've placed an orthodontic module, which is like an elastic band, around a tooth. And what tends to happen is because a tooth has the crown up the top there, and then the roots, it gets a bit narrower towards the root, and then particularly on the front teeth, gets really narrow towards the base of the tooth. Put an elastic band or a ligature or a floss over the top, tie that really tightly. The first thing it wants to do is just keep migrating down that cone. It's a way to extract teeth without having to do something over a very long period of time. So as that creeps down, the bone's going to disappear and you're going to start losing that tooth.
That seems scary.
It's terrifying. It's one of those things that has been shown as sort of a thing in studies or in case reports as well, that it can actually occur. So you need to be able to, first of all, control the movement. But you don't want to go losing the floss or losing the elastic underneath the gums. Otherwise, it's a bad thing. It's a very bad thing.
We don't want that to happen. No. And do you think there's, because I assume if people are really leaning into these at-home remedies per se to fix whatever they're wanting to fix with their teeth, whether that be crowding or gaps, is there a faster option between a fixed orthodontic appliance or clear aligners, or is it more case by case?
It's very much case by case. Right? It's a very individual sort of thing. And different goals suit different methods as well. The most important thing when you're talking to your dentist is that you talk through some of those goals that you're looking towards. So whether it is changing just the position of the teeth, whether it's aligning the teeth, changing your bite, lots of different things, or just closing a gap. There's often ways to do that without orthodontic treatment as well. And some of those sorts of things might be more suitable for you as well, and possibly even more cost effective than going down the road of orthodontic treatment. But if orthodontic treatment is your preferred option, once you've gone through all those sorts of things, at least you know that these are the steps that I could have taken. These are the routes that I want to go because I understand the pros and cons behind everything.
Yeah.
And you're going to be really comfortable with whatever option you choose from there. So
yeah.
I think that's a really important thing, more than anything else, more than trying to get fast results, is if you know the pros and cons of everything, you've talked to someone about them, and you can really sort of be guided through what's going to achieve your goals at the end of it. That's what makes it worth it.
Yeah, definitely. Getting those options, a clear understanding of what works best for you and what works best for your goals, I think is a better option than running towards floss or string or anything to get those quick fixes.
This sort of terrifies me because of some of the case studies that have been out there. So yeah, that's less than ideal. Yeah.
I can imagine. And a less than ideal at-home treatment, DIY veneers.
Right.
Interesting.
Yes. How are they sticking these on?
Glue-on resin kits.
Okay.
Which I'm intrigued to know how you feel about at-home DIY veneers, whether you think it's safe. Just let's dive into this one.
Sure. Well, from a dentist perspective on something like this, veneers are incredibly technique sensitive.
Yeah.
They're something that, as dentists, we're going to spend a lot of time going through the design process, doing the preparation process, getting everything ideal, and then the veneers go on.
Yeah.
That process of actually sticking the veneers on is super technique sensitive. You've got to be really, really accurate with what you're doing. One of the challenges is to avoid things like putting too much cement around there and sticking teeth together, in which case you've got to remove the cement, and you start this big cycle around there. Because as soon as you leave cement behind, you've now got something that's going to cause gum issues or inflammation or possibly even gum disease. From a technique point of view, it's probably the most demanding thing to do. Like, preparations are complex, design is complex, but actually cementing them is very, very demanding.
Yeah.
Not being able to see what you're really doing around there is going to make it incredibly difficult to get a great result. Even small discrepancies on margins, so where the veneer fits to the tooth, if there's a little gap or a bubble or anything like that, can cause significant problems. Or it's a space where bacteria just sits in there, or staining will sit in.
Right.
So they can look great for a certain period of time, but long term, it's going to be more challenging around there to keep them in that ideal position, or ideal situation. From the perspective of the patient trying to achieve something, I mean, I think it's a little bit like sort of the snap-on smiles where you pop the teeth over the top of your own. At least that's not cemented on.
Yes, you can take them off.
You can take those off, which would be my preference if someone was going to do an at-home version of things.
Yeah.
Something that is not stuck on
permanent.
To a tooth. That would have to be effectively cut off if we went down that pathway. Because removing them is very difficult to avoid damaging the tooth underneath as well. So it just ramps up each degree of difficulty, each degree of precision that goes on there, and trying to get that perfect result of something that sits there beautifully, is super even, achieves the smile that you want, and all the resin's cleared up, the cement's flush, all those sorts of things. There's so many technical requirements of doing that. I would best leave it in the hands of someone who knows what they're doing. And someone who does it all the time, which is one of the things that Dental Boutique is fantastic for, because they're just doing like those sorts of really complex tasks a lot around there. So you know where the challenges are, what you need to do, how you're going to achieve those results, and help guide people through.
Yeah. And there's almost an artistic element to veneer design as well. Not like the placement, but even just crafting the veneers, the design, how it's supposed to fit in the patient to make sure that it looks really natural and aligns with their goals. And I don't know how you're going to do that at home.
You've got a ceramist that's going to take the preparations and the molds and all those sorts of things that you have created as a dentist and patient combination there. He's going to take that and he's going to craft individual teeth for you. So they will be spending heaps of time painstakingly preparing those. A one-size-fits-all kind of shell over the top is not going to give you the same sort of result.
One size does not fit all with veneers.
No.
Which is crazy. And how would you approach even removing those if someone has done it at home? I assume it would be very complex.
You've got to grind them off, pretty much. If it's a resin cement that they're stuck it on with, it could be very difficult to remove. Some of the weaker cements you might be able to sort of flick off in sort of crack away those kind of things, which is a very unpleasant feeling on the teeth.
I would not enjoy it at all.
No, and most people wouldn't. But it also means that you've got to remove them very slowly. It's a very painstaking process. And just removing the amount of extra veneer, the dentist not knowing underneath how thick the veneers are. So you've got to try to just go really slowly, get rid of that, get rid of the cement, clean up the surface, and then you know your starting point, because there's no other way to tell that starting point other than removing the veneers.
The dentist is almost going in blind.
Very much so. Yeah. You don't know, like, you're digging for something that you don't know whether what the condition is underneath. So it's a very challenging situation to do. And done well. I mean, my front teeth, they're all veneers. They've been there for 18 years now. Still going strong. So from that side of things. What a win. That side of things, I would thoroughly recommend getting them done professionally. I don't think stick-at-home ones would last that long.
I don't think so either. Definitely not 18 years, and definitely not for your tooth health either.
Yes.
Well, that's all we have for today. Thank you so much for tuning in. Thank you, Dr. Michael, for answering some absurd TikTok trends that we have seen for cosmetic dentistry. If you've got any other questions or you've seen anything spotted on TikTok, please let us know and we might be able to answer them in our next episode. See you next time, and remember, your smile deserves expert care, not DIY hacks.